Hello, my name is Rachel. Today I will be doing a demonstration of a lower extremity venous Doppler ultrasound. So I'm starting with my patient's leg externally rotated, and I'm going to do compressions down the leg to see if there is a blood clot in this leg. So I'm starting at the level of the common femoral artery and common femoral vein at the groin crease. I'm going to compress, move down to what we call Mickey Mouse with the greater saphenous vein, compress. And I'm going to keep moving down the leg about 2 to 3 centimeters. Here I can see the two veins split. I'm compressing. I'm going to keep moving down. And here in mid, I can see a little extra. I'm going to make sure that compresses too. You can see it dove off there. And as I move down to distal, I'm going to have to squeeze behind the leg because of the bone. So I'm pushing the tissue up. Following it all the way through distal. Looks good. So now I'm going to go behind the knee for popliteal prox through distal. And prox is just an artery and a vein here. I'm going to compress. Keep moving down. You saw it split into two. Looks good. So all areas are compressible. So now I'll take my representative images using dual screen. On the left will be my vessels open. I'm going to start with the common femoral vein and the greater saphenous vein. The right will be with compression. So I'm going to clear up my image here, adjusting my TGCs, my focus. Clearing up the vessels a bit here. I'm going to switch to the right and compress. You can see here that they're compressed, and I could also see I compressed the artery a bit. They had already split into two here. Usually that just means I compressed well. So now I'm going to move on to the femoral vein proximal and the profunda femoral vein. So I'm going down to where the two split, right there. I'm going to clear up this image here, increase my depth, adjust my focus, see where it looks the nicest when they split. I want them to stack because usually that will be a clearer and better image for me. Seeing where it's the nicest, so I'm angling around a bit. Looks good. I'm going to compress now. Just the two arteries are left behind. Now I'm going to move on to the mid-femoral vein. And I'm moving down. I can see that little extra, so I'm going to make sure it compresses. I'm seeing where the artery and vein stack because it's usually a clearer image, nice window to use. Adjusting my TGCs a bit, angling to stack them. Now I'm going to compress, and you can see both veins compressed. Now I'm going to move on to distal. So I'm going to move down the leg, and I like to use an anterior approach for the distal. It usually helps clear up those vessels a bit. So I'm going more anterior and using a little bit of pressure to clear up the vessels, adjust my focus, my TGCs. I'm going to switch to the right, compress from underneath, push the fat up, and then I'm going to slowly cine back to where it's just the artery left behind. Now I'm going to move on to the popliteal vein proximal. So I'm going to go behind the knee once again And I'm going to go just about to that crease in the knee. Just above that is going to be your proximal, usually in most patients. So it'll be just an artery and a vein here. Adjusting my settings here, clearing it up a bit. I'm going to switch and compress. I have to slowly sennate back because I had to use my other arm or my other hand to keep the keep it from moving up the knee. Now, distal. I'm going to see the vein split into two right about here. So I want to make sure they both compress. And they do. Again, I'm going to slowly sennate back to where I just have the artery nice and clear. So now that I've done all my compression images, I'm going to move on to my sagittal grayscale, color, and Doppler pictures. So I'm going to go back to single screen, and I'm going to go back to the patient's groin crease to start at that common femoral vein and greater saphenous vein level once again. So here I can see the two together. I'm going to angle so that they stack. I'm going to turn on it into the sagittal plane, and here I can see the two nicely elongated. So I'm just seeing where they look nicest. I want the vessels as flat as I can for grayscale. Looks good there. Now I'm going to put the vessels more on an angle for my color. So you can see they're filling, which is what we want. I'm going to try and decrease the amount of bleeding that I see. There's not really aliasing, but I want to decrease that color gain. It's not a huge deal if you have some bleeding. What matters most is you have wall-to-wall fill in the vessel. You don't want any gaps of color. So I'm going to just see where I have the least amount of bleeding. So right about through there looked good. Here I can see the least amount of bleeding. You have wall-to-wall fill. That's what you want. I'm going to take the picture. And now I'm going to take a signal in the common femoral vein, turn off the angle correct. I like to place my sample gate proximal to the greater saphenous so there's no confusion as to where it is. So I'm going to adjust my baseline. I want it in about the mid area. I'm going to do my augment. And you can see the flow wrapped all the way around right through there. And my flow came back after. So that's exactly what you want. Now I'm going to take a signal in the greater saphenous vein. So I like to do just the proximal area, no need to elongate it or anything. Sometimes you have to squeeze the thigh, but I was able to get it from doing an augment in the calf just fine. Got a perfectly fine augment. And I saw the flow came back too. So now we're going to move down to the proximal femoral vein, as well as the profunda femoral vein. I'm going to turn on it into sagittal. Want the vessels cleared up as flat as I can. Adjusting some of my settings here. Looks good. And then now I'm going to take my color picture, steering my box in the correct direction, adjusting the size of my box. And I want to see where they fill the most. I think it's common that I have trouble filling both vessels all the way across, so I just do the best I can with it. Putting more of an angle to it if I can. Adjusting my color gain, my color scale. Here I'm able to see them both filled all the way across, and I angled the vessels more to get it to do that. So now I'm going to take a signal in the femoral vein proximal. I'm going to do my augment. And the flow came back. And you can see the augment all the way around, looks good. Next will be my profunda. This is another vessel where you might have to augment in the thigh, and that's what I am going to do here. And there, the flow wraps all the way around. So sometimes you have trouble getting a strong augmentation in the calf for the PFV and the greater saphenous vein. So now I'm going to move on to the area of the femoral vein mid. And usually where the two vessels, the artery and vein stack, is where it's going to look nice. So I'm around that area. And I want the vessel flat. As you can see both artery and vein. It's just usually a nice window. I'm going to take the picture here. I'm going to put it more on an angle for color. Looks really nice already. Take it there. And now I'll do my Doppler. I'm going to do my augment. Good. And the flow came back at the end. So I'm going to put it slightly off center just to see that the flow did come back. Now I'm going down to distal. I'm going to turn on it into sagittal. And I'm going to get the vessel flat if I can. It's a little harder in distal. It's because it dives a little more. I'm going to flatten that out to decrease the amount of internal echoes. Take it there. Now I'm going to put it on an angle more for color. Adjust my settings here. You could also have the patient take a deep breath out if you want. That can help with fill. Okay, looks good through there. Now I'm going to take a signal. I'm going to do my augmentation. Waiting, and it came back. So now I'm going to move on to the Popliteal Proximal. I'm going to go behind the knee once again to the area where it's just an artery and a vein. I like to find them in transverse first and then turn into the sagittal plane. Here I can see the vein. I want to make sure first that this is the vein and not the artery, but I think it is because it looks bigger. Yep, vein. So now I'm going to do my grayscale picture first. Flatten it out as much as I can. It's a little hard for proximal. Looks good. I'm going to do color now. So the fill isn't cooperating very well. Adjust my settings here. It's better, but not where I want. That's a little better. Right through there. So I moved down on the leg a little to try and get more of an angle on those vessels. Now I'm going to take a signal. Augment. Waiting. It came back. Looks good. Now I'm going to take a signal in the distal. I'm going to steer my color box in the correct direction. Adjusting the placement of my box. It's easy to compress the vein in this view, so I want to lighten my pressure a bit to make sure it's fully open. Looks good. I'm going to take the color picture there. And now I'm going to do my spectral. Augment. And the flow came back instantly. Looks good through there. So now I'm going to move on to the calf. So I'm going to look at the anatomy here, looking at the posterior tibial veins and the perennial veins. There I can see the posterior tibial veins. And I'm going to compress. I'm going to follow them down and keep compressing. I like to do one set at a time just to focus on the veins for each set and not get confused or mixed up between the two. You can see they move more superficial on the screen and they're compressing along the way. Compress. Compress until I start to lose them. That's as high as I can go. So now I'm going to do the same thing with the perennial veins. I'm going to find them right through here. I'm going to compress, follow them down, compress, keep watching them compress as I go down the leg. And they dive behind the knee earlier than the posterior tibial veins, so I can't follow them down quite as far. So now I'm going to do compression images, starting in proximal for the posterior tibial veins. The right will be with comp like we did for the other parts of the leg. So now I'm going to go proximal on the leg and clear up the image of the posterior tibial veins. Adjust my focus. I'm going to compress. And here I can see just the artery left behind. Now I'm going to move down to distal for the PTVs. So they're going to be more superficial on the screen now. I'm following them down. You can see an extra there. Okay. So I like how they look here. 3 in a row. I'm going to compress. Looks good. Now I'm going to move on to the perennial veins in the proximal region. So I'm going to start high up on the leg again. I'm going to find my perennial veins just lower to the posterior tibial veins. It's going to be they're going to be right above the fibula always. I'm going to compress. Now I'm going to move down to distal, and it won't be as far down as they were for the posterior tibial veins. They dive below the fibula earlier. Seeing where they look the nicest. This area looks good. Adjusting my focus here. And I'm going to compress. And just the artery is left behind. Teeny tiny little guy. So now I've done my compressions. I'm going to move on to my color images. First is going to be the PTVs. These can be tough images to get them to fill, so there's different things you can try. So I'll show you first. So I like to see where they stack. And then I turn on them into the sagittal plane. Once I feel like they're visualized nicely, I will turn on the color. You could always lower the scale to get better color fill if you need to, but it looks pretty good here. I didn't need to do much for these. You have wall-to-wall fill, no crazy amount of bleeding or aliasing. Now I'm going to move on to the perennial veins. Increasing my depth here, seeing where they stack. So I'm augmenting with 2 fingers on the patient's calf a bit. That can help with flow. You can have them take a breath out as well. The one's filling, but I want the one posterior to it to fill. So I'm making sure I'm on the perennial veins here and not the posterior tibial veins. It can be tricky because they're really close together. So I'm visualizing those perennials turning into the sagittal once again. Adjusting my angle to get the vessels to fill. Finally through here, I got them. And not a crazy amount of bleeding. You can see wall-to-wall fill. Looks good. Say to where they look the nicest. And that concludes my demonstration of the lower extremity venous ultrasound. Thank you.